Hello and welcome to this series around the Goldsmith indices of body symmetry. My name is Sarah Clayton and I'm a bit obsessed with measurement. I've worked in this field since 1998 and I'm absolutely passionate about the provision of objective outcomes for people, families, for children, young people and adults themselves, and for practitioners to get a really good understanding of the impact of all of the hard work that they are doing. So let's get stuck in. So the Goldsmith indices, they are, it's directional when we measure. Not only do we get an answer with regards to the degree of asymmetry, but it also tells us what direction that asymmetry is going in order to support us to understand the intervention that's required. They provide accountability for outcomes. Everybody's working hard. We all deserve to know whether what we're doing is working. If it's working, we crack on. If it's not working, then we make changes to the plan. It supports behavioural change. We're asking a huge amount of people, whether it's trying different seating, whether it's looking at nighttime positioning, whether it's looking at active therapy. We ask an awful lot and we deserve to know what's going on. It also provides an overall picture. Some people are confused by measurement of body symmetry, that it's to do with nighttime positioning. And that's all that it will tell you. But actually, it tells you a huge amount, which we'll go through in the next few videos. But as complex as the children, young people and adults are that we measure, the interventions are also complex, and the family life is also complex. So there is a lot going on, and measurement of body symmetry is one way of looking. It's a holistic measure that looks at the impact of all of those different things. There are some limitations. At least two of you need to know what you're doing. So the measurer and assistant two are the two people that have the most active role within the measurement. You absolutely need to know what you're doing. You need to practice. If you haven't measured for a while, you need to get your eye back in before you set yourself loose on people for whom these measures are really important. It does require some specialist equipment. So we have the AMI, the anatomical measuring instrument, which was designed purely for use to measure the Goldsmith indices, and it's not a replacement for other measures. So it's not CPIPs or the Goldsmith indices, and it's not a MAT assessment or the Goldsmith indices. All of these assessments tell you slightly different things, and as we've recognised before, these are complex individuals. We need as much information about where the person is at before we can start making decisions about, kind of really important interventions. There are lots of advantages to the Goldsmith indices. So just quickly to go through it has both inter and intra-rater reliability. That means that you could measure a child and your colleague can measure a child and you can compare the results. So that's the inter-rater. And intra-rater means that I can measure the same child repeatedly and I can compare those results. It allows for very early identification of asymmetry, which we will go on to talk about a little later. But because we look at symmetry of movement as well as symmetry of structure, we can pick up very, very early on. We usually say from about 2 years of age. The youngest child that I measure will be about 2. But we can see in that asymmetry of movement long before we'll see changes in their structure. As I said, it's a holistic measure of lots of different interventions. It provides positive feedback. It can be analysed both at an individual level, what's happening to this young person, but we can also, because we have a standardised data set, we can also then look and say, well, what's happening with our key stage 1 pupils? What's happening when young people go from paediatric services to adult services? Because we've got that inter-rater reliability, and because we're looking at the same measures across a whole group of people, then we can look at population level. Always good for commissioners, that one. It provides a range of results rather than a single number. So I measured a little girl 2 days ago. She has a windswept index of 1.25 degrees. That could mean that we all go home and say, brilliant, well done us, she's symmetrical, that's great. But actually, when we look at her range of results, she is very, very much shifted over towards, actually for her, it was towards the right. So whilst the windswept index is relatively symmetrical, actually there is a pattern of movement that's developing that is a concern that needs to be addressed before it becomes, kind of embedded. You can repeat the measures as often as you like. Parts of the measure can be used as appropriate for different people. It might be that you have a child who you need to split the measure up because they don't like to be on the plinth for any length of time. So it's a really flexible measure, and it's also inexpensive. So let's have a quick look at what we're actually measuring. So we need to get confident, super confident, feel it in your bones confident that you know what typical looks like. And that sounds ridiculous, but bear with me. So a typical child, somebody with typical symmetry, when we lie them down and we have their knees upright, then when the knees are to the ceiling, when the knees are upright, their pelvis should be level and their sternum should be central. Now, what we're doing when we measure using the Goldsmith indices is we're measuring that movement away from typical. So when we lie the child down and their knees are upright, if their pelvis is not level, what side is higher? Because that's the side to which the child is wind sweeping. If when we have their pelvis level, their sternum is not central, then where is it? How far away from central is it? In what direction is it going? And we can start to build a picture of a child's asymmetry from this, as I say, this standardized data set, and we can build a picture in our minds just by looking at the numbers of what this young person looks like. But get really confident in that idea that typical is knees upright, pelvis level, sternum central. Where is the child that's in front of me? How are they moving away from that? Are they moving away from that? And if they are, what do I need to do in order to bring them back to symmetry? So that's thinking about symmetry of structure, but we also need to think about symmetry of movement, because generally it's symmetry of movement that we'll lose first. And that's simply thinking about when I take that child's knees from side to side, this fictional child that is in front of me lying with their knees bent, pointing to the ceiling. When I take their legs from side to side, their pelvis will respond. And what I'm looking for is the relationship between legs and pelvis on either side should be symmetrical. So their ab-lap, and we'll talk about that a little bit later, the angle between legs and pelvis should be the same or pretty much the same on either side. If they're not the same, then the side to which the ab-lap is greater is the side to which the child is wind sweeping. That will generally match what's happening at the pelvis, and it will match what's happening at the chest. And we will talk about that a little later. So asymmetry of movement usually comes first and feeds into asymmetry of structure. So by the time the young person in front of you has been diagnosed with a scoliosis, there has been a whole series of events preceding that we could have picked up on. Okay, so we need to think very carefully about how we're tracking children that we know are at risk of changes in their body shape. So what might that look like in practice? We might have a child who has an atypical windswept index, so that movement from side to side is not the same, is not symmetrical. So that's your first warning sign. But when you lie them down, they're able to achieve the optimal start position. So do you worry about them? Yes, you absolutely do, because there is a flag there saying, I'm doing something unusual, I'm doing something atypical. If we don't do anything, what happens then is that windswept index worsens, and eventually we'll see that feed into structure, and the child won't be able to achieve the optimal start position. So we're looking, when we look at the movement from side to side, the windswept index, that's that really early warning system that things are starting to go wrong. When we are looking to intervene, then that's the side of things that will improve quickest. So we'll see improvements in the windswept index generally before we'll see improvements in structural symmetry. So you need both measures. It's not just if the child can achieve the optimal start position, they're symmetrical, we all go home and have a glass of wine. If they can achieve the optimal start position, great. Is there anything in their movement that we should be worried about? Okay. Further advice and support. If you have an AME, then we will support you. We have limitless CPD certified training for yourselves, for your team, for new members of your team, for refresher courses, anything you want us to do, including looking at some of your results and helping you to interpret. If you're not used to interpreting that data yet, then please do get in touch and I'll be more than happy to help. Goldsmith and Goldsmith, so that's myself and Anna Goldsmith. We offer private measurement and assessment services in collaboration with, it's usually children and young people's therapist, to look at both measurement and then working out what to do in terms of intervention. Born at the right time, all of your online CPD certified co-productive postural care training, that's the place to go. And finally, Clinical Excellence Online is an internationally recognised team of expert clinicians within their subject area. I'm not a clinician, I am a biologist by background, but I'm pretty good at what I do. So I am one of that panel, and I provide coaching for therapists, paediatric therapists that are looking to use measurement of body symmetry or postural care. You can email me, training@simplestuffworks.co.uk. You can call the office on 01827 307 870, and I'll be more than happy to talk to you. Take care.